video tutorial for microbiology with Charnik. So in that video I am going to wrap up my discussion regarding fungal disease. So remember one thing, that as we have discussed to do fungal disease and any kind of disease chapters suggestively, so by analyzing previous year questions, I have just found that they only ask 4 or 5 type of questions from fungal disease. One type is why fungal disease infection treatment is difficult more than prokaryotic or any kind of bacterial infection. Second question that they ask is why candida infection is difficult to diagnose. That I have also discussed with you, that candida is our normal for us, so it is difficult to diagnose. Third type of question is write a short note on the mechanism of amphotericin B. I have also discussed it with you. And the fourth one is the mechanism of grisofulvin. It is also an important question. And the fifth type of question that they usually ask is all about, in brief, regarding the disease candidiasis. So today I have decided to discuss about the candidiasis in details. So let's start. First of all, we need to know what is candidiasis. So candidiasis is a type of fungal infection caused by yeast candida. Some species of candida can cause infection in people, and among them the most common one is candida albicans. Candida, we have already discussed that candida is a normal flora, so they usually lives inside the body, such as in mouth, throat, gut, vagina, without causing any kind of problem. But candida can be problematic if it grows out of control or if it enters deep into the body, such as blood, brain, heart, kidney, joint, etc. And that is the thing that we called invasive candidiasis, right? This invasive candidiasis is the most lethal type candidiasis. So let's discuss about the first type of candidiasis that is included in our syllabus, that is vaginal candidiasis. Although vagina is the normal place for candida to live in, but if vagina provides a suitable environment to them to grow and multiply, so in such cases candida can cause infection to vagina, and such kind of infection are called candidal vaginitis, vaginal candidiasis, vulvovaginal candidiasis, and most commonly called vaginal yeast infection. So we have to remember about the symptoms. So vaginal itching or soreness, pain during sexual discomfort, pain and discomfort when urinating, abnormal vaginal discharge. So these are the symptoms. And most unfortunate cases, although most of the vaginal candidiasis is mild, some of the women can develop severe infection involving redness, swelling and cracks in the walls of the vagina. So we have learned that vagina can be a place to cause infection for candida, and it is called vaginal candidiasis or vulvovaginal candidiasis or candidal vaginitis or vaginal yeast infection. Okay, so this is a normal one, but the most important one is invasive candidiasis. So invasive candidiasis, unlike candidiasis in mouth, throat, esophagus, vagina, it is a serious type of candidiasis because it affects the internal part of our body, such as blood, bone, joint, our heart, brain, kidney, etc. The most important MCQ can become, what is candidemia. So candidemia is the infection of bloodstream by candida and most common infection in hospitalized patient. So what is the symptoms of invasive candidiasis? Remember one thing, that invasive candidiasis is usually developed by people who have already developed another medical condition, okay, or another, who have, in normal words, they already sick from another kind of disease. Okay, so it is very difficult to distinguish which symptoms are specifically for our invasive candidiasis. Okay, so although some kind of symptoms such as fever, chilling can be symptoms for invasive candidiasis if this fever and chilling is not recovering after antibiotic treatment that have treated or that have applied in respect to the susceptible bacterial infection. Because I have told you that people who have already developed a disease are normally affected by invasive candidiasis. So the already for the treatment of already affected disease, if that treatment have the ability to remove the fever and chilling, then it is okay. Otherwise we can conclude this kind of symptoms as a symptoms of invasive candidiasis. And other symptoms develop if unfortunately it can spread inside our internal part of our body, right, such as bone, eye, brain, heart, joint, etc. So let's move to the next part, that is diagnosis and testing for invasive candidiasis. What can you how healthcare provider diagnose invasive candidiasis? So they will simply take a blood sample or sample from the infected body site and sending them to laboratory to grow them in culture and to see whether candida grow or not. Now, what is the treatment of invasive candidiasis? Here you have to remember that for most adults, echinocandin is recommended. This is very important, and which is given through the vein, intravenous. Okay, along with fluconazole, amphotericin B, and other antifungal medicines may also be important in certain situation. Okay, depending on the situation. So amphotericin B is, we all know that, causes cell lysis by interacting with the ergosterol of the fungal cell membrane. If you have not watched my amphotericin B mechanism of action video, then I will suggest you to go and watch. So now the last type of infection, that is candidiasis in the infection of the mouth, throat and esophagus. Okay, so candidiasis in mouth, throat are commonly called as thrush or oropharyngeal candidiasis. Okay, and another kind of candidiasis, that is candidiasis in esophagus, is called esophageal candidiasis. Okay, and this kind of candidiasis is mostly occurred in case of people who have already developed HIV or AIDS. Okay, so that is the idea. So we have to discuss about the symptom. Let me zoom it. Okay, you have to remember the symptoms mainly: white patches on the inner cheek, tongue, roof of the mouth and throat, redness and soreness, cotton like feeling in the mouth, lack of taste, pain while eating and swallowing, cracking and redness at the corner of the mouth. And symptom of candidiasis in the esophagitis usually include pain when swallowing and difficulty swallowing. So that is the symptoms of candida infection of the mouth, throat or esophagus. Let's revise with me that: white patches on the inner cheek, roof of the mouth, tongue and throat, redness and soreness, cotton like appearance inside the mouth, lack of taste, pain when swallowing or eating, cracking and redness at the end of the or at the corner of the mouth. And symptoms of candidiasis in esophagus usually include pain when swallowing and difficulty swallowing. So that are the symptoms regarding candida infection of the mouth, throat and esophagus. Situation what usually occurred in case of esophagus, it is usually diagnosed with the help of endoscopy. Okay, and the treatment that usually medical practitioners use to treat esophageal candidiasis, remember, is fluconazole. Although I am going to discuss about this in the last slide. Okay, So, and this kind of situation can be observed in case of oropharyngeal candidiasis. That means candidiasis in mouth, okay, and throat. So, diagnosis and treatment, that is the specific, not specific for any special kind of candidiasis, but this diagnosis and treatment is common to all kind of candidiasis, okay. So healthcare providers usually diagnose candidiasis in esophagus by doing an endoscopy. For in case of mouth and throat, they just can detect usually candidiasis just by seeing inside the mouth, and small sample from mouth and throat often is sent to laboratory for further inspection. So treatment for mild to moderate infection to mouth and throat usually treated with a kind of antifungal drug for 10 to 14 days. These medications are usually clotrimazole, fluconazole and nystatin. You have to remember these names, okay. And the treatment for candidiasis in esophagus is usually fluconazole, okay. So clotrimazole, fluconazole and nystatin is in general use for candidiasis, but you have to remember one thing, that for invasive candidiasis we have, if our patient is an adult, so we have echinocandin, okay, echinocandin. And in case of our candidiasis in esophagus, we have fluconazole, and other amphotericin B, miconazole, nystatin, clotrimazole are also associated. So that's all for candida for now. So we have completed our fungal disease chapter totally, okay. We have to just prepare 4 or 5 type of question that I have seen in 10 years previous year questions. So one type of question is why fungal disease is difficult to treat than our normal bacterial disease, why candida infection is difficult to diagnose, and what is the mechanism of amphotericin B, what is the mechanism of grisofulvin. They will simply give you the question in such a way that name to antifungal drug and mention its mode of action. They can ask you the symptoms of vaginal candidiasis, they can ask you the symptoms of invasive candidiasis and treatment that can be used for invasive candidiasis. I have discussed with you, that is our echinocandin and amphotericin B. Our fluconazole can also be used depending on the condition, and they can also ask you what are the different symptoms that you can observe if during the candidiasis in mouth, throat and esophagus. I have also discussed with you. And what is esophagus? Esophagus is the tube that joins the throat and the stomach, okay. Esophageal candidiasis can be diagnosed by how? With the help of endoscopy. And what are the treatment that we can provide for esophagus candidiasis? So this esophageal candidiasis can be treated with the help of fluconazole. So that are the different kind of question I have seen. I have observed that they generally rely on candidiasis during the questioning, okay. Or if I can find any kind of question from histoplasmosis and tinea stuff, then I will surely inform you via my video, okay. So till then, bye bye, take care.